Hello and welcome to the EduTalk series hosted by Biotone EduPartner School Program, and massage industry experts. With the continued interest and popularity of the EduTalk series, Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise on topics not only for class discussion, but career success. Tonight's expert is Dr. Kerry D'Ambrogio. He is a physical therapist, osteopath, and a board-certified acupuncturist. Kerry's author of Positional Release Therapy by Mosby and has contributed numerous articles to industry publications. Kerry began his career in 1988 and is founder of D'Ambrogio Institute, teaching orthopedic and energetic manual therapy to empower informed treatment decisions. He's an international lecturer, a certified instructor, recognized by the Upledger Institute, Barral Institute, and International Alliance of Healthcare Educators. Let's listen and learn as Kerry explains how systemic lymphatic balancing, STLB, reduces congestion in the joints, tissues, and cavities to improve circulation, relieve pain, and enhance range of motion while restoring function. Kerry will explore what STLB is, when and where to use it, systemic versus specific approaches, and include guided systemic lymphatic pumping exercises with before and after self-assessment. So we have a lot to get to. Kerry, thank you so much for joining us. And I'm going to exit the screen. I'll come back at the end to help you out with chats.
All right, thank you. You did that perfect.
I'm learning. We'll see you in a little bit. It's all yours.
All right, take care. All right, so welcome. I've got you guys for the next 50 to 60 minutes. Tonight, we're going to talk about systemic manual therapy or systemic lymph balancing. Typically, this is a 3-day class, and I've condensed it into 1 hour. And I want to make it very user-friendly for you. I've given you lots of handouts, and I'll kind of go over what you have. My goal today is to introduce some information you'll find interesting, but also give you some tools, that you can use at the end. All right, so let's start with this. All of us as practitioners, you guys being massage therapists, we're all faced with the same 3 questions. Let's say 2 patients come into your office and they both have knee problems. They could have anything. They could have neck problems, back problems, it doesn't matter. The question we all face as practitioners is, where do we treat? Okay. Are we going to treat the knee or are we going to treat somewhere else? And how do you make those decisions? Let me go to the vibe board for a second. Now, over here, let's say the patient comes in and they have right knee pain. So you have to decide, do I need to treat this right knee? And we would call that specific approach, right? Where you're specifically treating the knee. Now, if you were going to treat somewhere else, how would you decide it, or why would you do that? We have to ask a different question. We'd ask, well, how does the knee heal? Well, the heart has to send blood carrying oxygen and nutrition, that the knee needs that to heal. But in order to receive it, you need to get rid of the waste products. And we do that through the venous system. And what this talk is about is the lymphatic system. Okay. There's an old saying, drainage precedes supply. So what that means is that in order to get the good stuff to the knee, you got to get rid of all the toxicity. We also have another system, your central nervous system, your brain and spinal cord, and there's nerves that go to the knee and back and forth. So if there was a problem here, we would call that systemic. Okay, we call that systemic. So those are our 2, big approaches. So where do we treat? We either treat the knee or we treat somewhere else, but more systemically. The next question that we ask is, what do we treat? So if we go back to this example here, if we knew that the problem was, let's say, at the knee, what are possible treatments? We could do a fascial balancing if there was fascial scar tissue. We could do muscle balancing if there is protective muscle spasm. We could do joint balancing if we knew that the joint was hypomobile or stiff, or we could do lymphatic balancing. So this is all called specific treatment. All of these are specific treatments at the knee. So that means that we could do specific lymphatic balancing at the knee. But what if the problem was more systemic? And and how would we decide what to treat? We could have problems with the transverse diaphragms. We could have problems with lines of fascial tension. You could have more of a systemic congestion of lymphatics. So we need to decide this. So as practitioners, we're always faced with these questions. When a patient comes in this example with knee pain, first of all, where are we going to treat? Are we going to treat more specifically or more systemically? And once we decide that, what exactly are we going to focus on? If it's specific, are we going to focus on the fascia, the muscles, the joint, or very specific swelling? Or if we're going to focus more systemically, what are we going to focus on? Again, we can focus on fascia, the joint, the muscles, etc., but it's more spread out. And also you can get more of a systemic congestion in the body. So that's what this talk is about. So the third question is, once we decide, where we're going to treat and what we're going to treat, the next question is, well, do I have the tools necessary to treat it? I'm going to give you those tools today, but that's our focus. At my institute, we focus a lot on answering these questions. And how do we do it? My philosophy is very simple. It is a three-part. Remember, I used to play football, so I had to keep it very simple. We evaluate. And through the evaluation, we can determine whether we treat systemically or specifically. So the evaluation determines the treatment approach. And then we reevaluate to find out, were we successful? And if we're successful, we learn from that, but also, where do we go next? You have a copy of this. This is one of your handouts. This is how I make my clinical decisions. The first thing I do is something called a total body screening examination. And this is what it is here. Now I can go to the Vibe board here. Now in this total body screening examination, we evaluate posture in different positions. We take a look at the spine to see any asymmetries in the sacrum. And all of those mean different things. We also look at lines of tension in the arms, the legs, the head and neck. We look at the 3 transverse diaphragms, and we also look at the thoracic and the abdominal cavity. So if somebody has a lot of issues going on, if they have a lot of findings, we would call that, systemic. So if somebody came in and they had that right knee problem, okay, and we found all these different findings, we would call that systemic. Versus if somebody came in and they have a right knee problem, but when we evaluate that person, we only find tension, let's say in this leg, maybe we find an asymmetry at the sacrum and the pelvis, but you can see that the diaphragms are all open. So that means that there's going to be, good flow through the body. Remember, we talked about, in order for the knee to heal, you need blood supply, carrying oxygen and nutrition, but you also need venous and lymphatic drainage. Well, there's nothing being blocked here, right? And there's no lines of fascial tension anywhere else. It's very local. So we would call this specific, okay? That would be specific. So when we go back to this evaluation, we can look at posture, we can look at lines of tension, and we can look at the cavities. Now, this total body screen examination will tell us within 5 minutes whether we need to do a systemic or a specific approach, okay? Now, if it's a systemic approach, if we see a lot of findings, Then we actually do a systemic evaluation, and this tells us exactly what we need to treat. We have a systemic orthopedic approach, a systemic lymphatic approach, and also an energetic balancing approach. And how do we know we're correct? Because we reevaluate. So it's a whole system, that we teach. Because you have to figure out, it's not good enough just to know treatment. You have to know when to use these treatments. And this is how we determine it. If we find out through that total body screening examination that the problem is more specific, we actually have a specific evaluation. And this will tell us whether we do a muscle balancing, that's the MB, or the fascial balancing, or the joint balancing, or lymphatic, or even energetic. And how do we know we're correct? We reevaluate. Okay. Now, I've included this in your handouts, and you can see that there's a QR code. So you'll have this. If you use that QR code, you'll get access. This is about an hour, hour and a half video. It's all free, but it's going to go into detail how to use that chart and also the evaluation. Okay, so that's a gift for you. So we're going to, in this class, we're going to assume that you are systemic lymphatic balancing. And we're going to talk about, well, how do we address that? Okay, so that's our assumption. So first of all, I wanted to thank Biotone for having me here in Donnell. And when she asked me to do this, I go, yeah, I'll do a talk on this. And this is what I came up with for tonight. We're going to talk about, what is lymphatic balancing, why learn it in the first place, what's my background to teach this. I'm going to briefly go over a little bit of lymphatic anatomy because you need to know that. And then what I want to do is go over some principles. I'm going to have you guys do a self-evaluation at the end where you can evaluate your posture, you can evaluate your range of motion. And then I'm actually going to take you through a series of exercises. All the exercises are going to be included in this little study guide I gave you. The study guide has all the exercises written out, and you also have a copy of my PowerPoint slides. So you can just sit back and just listen because it's all there for you, okay? So what is lymphatic balancing? Well, it's a manual therapy. Its focus is to relieve congestion in the body, either specifically, in our example at the knee, or more systemically. And how do we know which one? Again, the total body screening examination and either systemic or specific evaluations to kind of figure out, what's going on. Now, lymphatic balancing does a couple things. It removes accumulated edema, right, and waste products in the soft tissue, but also in the joints and in the cavities. People always think it's just soft tissue. No, this technique is for the soft tissue, it's for the joints, but it's also in the cavities and therefore the organs. Okay, so it can do all that, especially if it's systemic. When you do this, when you remove a lot of the congestion and the waste products, you're going to decrease pain in the area. And because you've taken away a lot of the fluid, you're going to improve range of motion. It's going to change right away. I've seen people come in with, a blown up knee or hip or shoulder problem, and you can see changes right away. It's quite dramatic. I was just in Canada teaching in Saskatchewan, Saskatoon, and it was a lot of fun because it was live, and I picked somebody who was really congested, and the exercise I'm going to show you later today, they did them and you could see immediate changes right away. But we'll get you guys to be the judge of that. Now, this technique is going to allow for tissue healing. Well, how does that work? Well, all those little cells, they need oxygen and nutrition. That's the blood supply coming in. In order for those cells to receive it, you got to get rid of the toxicity. And that's where the venous return and the lymphatic return, come in handy for that. Okay. And when I teach this, I actually follow, the physiological approach that we use for lymphedema. We teach the lymph anatomy, but also the physiology. We use a lot of the principles. But when my courses, we are focusing more on the orthopedic patient. We're going to incorporate, because of my background as an osteopath as well, we were taught a lot of lymphatic pumping exercises. And I'm going to show you active lymphatic pumping exercises, but there's also techniques that you can do as well. Okay? Now, this is going to make the approach that we have, you could use it on patients who have lymphedema, but our focus is going to be on the orthopedic injuries, certain medical conditions like that. Okay. So the next question you might have is why learn lymphatic balancing? Okay, why learn this in the first place? So if you look at this picture, the heart, right, is going to send blood all the way to the tissues, carrying oxygen and nutrition. Inside those blood vessels, we have proteins, and proteins exert something called colloid osmotic pressure. Blood pressure tends to push the fluid forwards. Colloid osmotic pressure tends to pull it inwards. So what happens is at this arterial end right here, so these are the capillaries, at the arterial end, blood pressure is greater than this colloid osmotic pressure. So what happens is fluid is going to leak out into the interstitial space, and it's going to bring with it oxygen and nutrition for the cells. In order for them to receive it at the venous end, blood pressure is less than colloid osmotic pressure, so fluid is attracted back into the venous system. So you can see here that we have the arterial system, and here we have the venous system bringing it back to the heart. And what does the heart do with it? The heart will send it to the lungs, right? So we get rid of waste products through breath. When it comes back to the heart will then pumps it out. And where does it go from there? It goes to the liver. And what does the liver do? It detoxifies it. It actually turns it into bile. So when you have a fatty meal, you get rid of a lot of that toxicity. It also goes down to the kidneys, and the kidneys will filter it out and you'll urinate it out. Okay. So we get rid of toxicity through bowel movements, right? From eating food, the bile coming in through the intestines, through urination, right? From the kidneys, through breath. And another way we lose things is just by sweating it out. Okay. Now you can see that the lymphatic system here in green, it starts here. And the lymphatic system in green here, it's a one-way system, but look what it does. It goes back into the venous system. So it's going to do everything we just did, but it's just there's two ways to get back. There's one way, right, for oxygen nutrition to get there, but there's two ways for things to get back. Why are there two ways? The lymphatic system is a wider diameter, so it can deal with larger molecules. It's slower, so it's going to deal more with detoxifying. And notice here, this little green thing here, this is a lymph node. And this is going to be a purification center. Inside those lymph nodes are going to be T cells, B cells, macrophages, and they're going to clean things up before they enter the venous system. The lymphatic system is a very slow system, slower than the venous system. To give you some context, if 30 liters were to come in, through this arterial end, carrying oxygen and nutrition, at the venous end, only 27 liters comes back. So the venous system actually handles a lot of the waste products. The lymphatic system will handle only 3 of those liters. Okay. But it's going to be a slower process. Okay. As we get through. All right. So let's talk about foundational experience. So my background is I started out going to school basically to play football. I was an inside linebacker, and I'm from Canada originally. And back in your early 20s, you think your body's invincible. Well, mine wasn't. Being a linebacker, I had lots of concussions, I had shoulder injuries, knee injuries, back injuries. And what happened is I would go to the athletic therapy center. They would submerge you into ice cold whirlpool tanks. You had to stay in there for, like 10 minutes. They'd pull your lifeless body out, and they would do ultrasound, electrical stimulation, massage, exercise. And I found that those treatments did help to a certain extent, but they'd get rid of the acuteness, the redness, and things like that. But I always found that there was something missing. I found that my groin, was tight, When I tried to change directions, I couldn't do anything. And so it got very frustrating. And I realized that, my days were numbered playing football. So I decided I'd be an athletic trainer first, and I worked with other teams. And I went to physical therapy school, and that's where I met one of my first mentors. And he introduced me to osteopathy. I became an osteopath. And in osteopathy, I started to learn that it's not so much about the technique, it's about understanding anatomy and physiology. And in osteopathy, they believe that the rule of the artery is supreme. What does that mean? They mean that your body parts are going to heal with what we talked about, oxygen and nutrition from the arterial system. But in order to get it, venous return, lymphatic return. So it's a physiological model. What can interfere with this? Fascial disturbances, protective muscle spasm, joint restrictions. So the role of manual therapy is to create a better environment for the body to heal itself. Okay. And then, for me, when I started to take all these different classes, for me, it wasn't just one approach that helped me, it was an integration of everything. It was the fascial work, visceral work, cranial work, strain counter strain, muscle energy, all these things. Because every time I had different things released, I started to feel better. So even though I'm talking about lymphatics, I've been doing it for a long time. That's not my only way of treating people. It's part of a bigger system which I introduce to you. Okay. And so I've been teaching for my institute, the D'Ambrogio Institute, but also I've taught for the Barral Institute and also the Upledger Institute and also the Body Talk Institute. Now let's go over a little bit of lymphatic anatomy, okay? Not too much. So we talked about this already. We talked about how blood supply comes down in here carrying oxygen nutrition. And we said that blood pressure is greater than colloid, so fluid will leak out, carrying all this oxygen nutrition. And then at the venous end, colloid osmotic pressure was greater than blood pressure, so fluid would come back in. And most of the fluid would come back through the venous system. Remember, I said 30 liters would leak out and 27 liters would come back in through the venous. The other 3 liters has to enter in the lymphatic system, and it's a one-way system, and it's back into the venous system. So remember that. It comes back into the venous system, and it does go through lymph nodes. Okay. This is a really nice picture here. This is showing you your skin. Everybody feel your skin and then sink into your muscles. It's not a big space there, is it? So that's our superficial highway. And if you notice, there are lymph nodes there, and these little collectors are heading towards them. We also have a layer of fascia, and below that, if you feel on your arm, you feel muscle, you feel bone, you can feel joint. Well, we also have a deeper layer of kind of collector vessels, and there's also deep lymph nodes. So a thing for you to remember, if you put your hand together like this, and then you do this, this is for the arm, this is the main highway like this, and it's all going to flow to your armpits, okay? There are lymph vessels here, but they'll all come around this way. And it's the same thing with the inside of your legs. If you know where the key lymph nodes are, then you know the direction of the flow. So the key areas you want to know is the axillas, the armpits. Everything flows, and we're going to show you where into that area. Also, all here is going to flow down into the neck and the clavicles, right? If you feel your groin, they flow into there. Those are key areas. There's lots of lymph nodes everywhere else, but those are key areas of drainage. Okay. Now, look at this beautiful shot. Remember, here we have muscle. Look at the lymph vessels on the outside of your muscles where the fascia is, but look how it's found deep in there. So when you're in a lot of protective muscle spasm, and remember, there's fascia wrapped around these muscles as well. So we're talking about that circulation. It's not just, superficial, it's very deep. That's why these exercises I'm going to show you today, these active lymphatic pumping exercises, will help to generate a good muscle pump to get this lymph flowing. Lymph is also found within bone itself. And it's interesting that some patients, they come in with a pain in their bone, and it could be a buildup of toxicity. That's why that systemic lymphatic drainage is so important. These exercises I'm going to show you are very important. It's also found in joints as well. And look at this. It's also found inside nerves. Okay, the nerves have it as well. This is all the deep drainage. Okay. Now, this is important here. These are three key zones. Everybody feel your clavicles, your collarbone. Okay. And then if we draw a line down midline, everything on the left will drain left, everything on the right will drain right. So the key areas is going to drain into the anterior part of the neck and your supraclavicular region. This means that your neck, the front, the sides, the back are all going to drain here. Your face is going to drain here. Your cranium is going to drain here. Also, your brain is going to drain here. Okay, so this zone one, all of that is going to drain into this area. So that's important for you to remember. Okay, and you can see that it drains here into these jugular trunks. Remember, your jugular veins are here. So we have in green here, we have these right and left jugular trunks. And look where they drain. They drain into your subclavian vein, your superior vena cava, and it goes to your heart. So your heart, remember, is the final place that everything goes. Okay. Now, if we go to zone two, feel your clavicle, but then feel your belly button and draw an imaginary line and then draw a midline point. Everything on the left drains left, everything on the right drains right. And it goes into, remember we talked about this, the axilla nodes. So your chest, your breasts, your upper abdomen, your arms, your thoracic spine all drain into that region. Where does it go from there? Subclavian, right? Trunk. Subclavian means below your clavicle. And we have one on the left and the right. And look where it drains into your subclavian vein. And then your superior vena cava, then it goes to your heart. Okay, so it all comes down into here, right? Into the heart. Now, zone three, if you feel the belly button, feel that line across, and it divides in two, meaning everything on the left goes left, everything on the right goes right. And look where it drains into. If you feel in your inguinal area, that's where it drains. Where does it go from there? Well, it drains deep into the body. See all these lymph nodes in here? These are all for the organs. So we have a left and right lumbar trunk here. And notice they left and right, they'll meet in the center. But we also have an intestinal trunk, which drains a lot of these organs. So if we put it all together, we have three different trunks. We have the right and left lumbar trunk, and they drain your lower abdomen, not your organs, lower abdomen, your external genitalia, your lumbar spine, your sacrum, your pelvis, your legs, both your legs are going to drain in there. And as they drain in there, they're going to mix with all your pelvic organs, and then they're going to mix here with all your abdominal organs. They all meet here just below your respiratory diaphragm. It's called cisterna chyli. And this is the thoracic duct that goes all the way to this left shoulder area, and then it drains to the heart. Okay? So you can see that this lower, the zone three, has to go through this abdominal cavity. Okay? So we're missing one area, right? We haven't talked about your thoracic cavity. So your lungs, mediastinal, all of that area there. So how does that drain? Well, it's going to drain upwards in these left and right bronchial mediastinal. And look, it's going to drain as well into the subclavian veins and then to the superior vena cava and then to the heart. Okay. Now let's talk about principles. Okay. So you have to know your lymphatic anatomy. I did it very quickly, but just so you know, and we go into a lot more depth. I spend about an hour and a half on this. So you just know that you have three zones, right? And know where they're draining to, but also know you have two key cavities, kind of the abdominal pelvic cavity, and we talked about that, and also your thoracic cavity. And we talked about all the different trunks and that all basically drains into the subclavian vein, superior vena cava, and to the heart. You also have to know the drainage patterns. And we just went over that with you. So you want to review that again. And again, we spend more time on that. When I get to the exercises, you'll be able to see that, and I'll remind you. Now you have to understand lymph flow dynamics. Everything has to flow back to the heart. The area of the chest, that's your thoracic cavity, should be the area of greatest negativity. Okay, right here. Everything has to flow from a high to a low pressure. Okay, so everybody take a big breath in. When you breathe in, your chest should expand anterior. Your ribs should expand laterally. Your respiratory diaphragm should go down, right? This should go up. So when you breathe in, your volume increases. When your volume increases, the pressure decreases. That's what we want. We want this area to be an area of greatest negativity because things move from a high to a low pressure. We want things to flow back to the heart. Your arms, we want them to flow back to the heart. From your legs, everything we want to come back here. So if you have restrictions in your transverse diaphragms, if you have restrictions in your ribs, and you try to breathe in and there's no movement there, you're not going to get good drainage. So when we treat this manually, we need to open up those three diaphragms. We need to mobilize those ribs. That is the first thing we need to do, right? Or nothing's going to move anywhere. Okay. So that's important. Now, there's a principle. We always want to start at the heart, and then we want to go outwards. We need to work proximal to distal, and then distal to proximal. That's how we're going to do the exercises. If I find that you're systemic, but you're more orthopedic, think of orthopedic as the skyscraper principle, meaning we have to balance from the bottom up. Okay. We have to release all the tension in the area. Let me give you an example. Okay. I had a patient who had 10 years of headaches and neck pain. Okay. Right in here. Now, when I evaluated her, she had a lot of problems here and here. Her diaphragms were restricted. So you can see that she is systemic. 10 years of it, everybody was treating her neck as if it was a specific problem. When she lied on her back like this with her legs straight, right, arms by her side, and if I tried to lift her head and neck, I couldn't lift it. But if I asked her to bend her left leg, which would reduce the tension of fascia in this left leg, if I asked her to bend her left arm, which is reducing the fascial tension, and let's say this head moved easy this way, and if I turned her head that way, I could lift this head and move it anywhere I wanted because her problem was due to all this fascial problems in this area. So this is more systemic. Okay, this is more systemic. When we do someone, and so if I'm going to treat her, I would start here and work my way up. So if somebody is systemic and orthopedic, we balance from the bottom up. Think of the head and neck as a penthouse of a building. You want to treat all the floors below it. If somebody is more, let's say she's congested, let's say everything is congested, right? And things are all blocked up in here. If you tried to treat down here first, you're going to make it worse. Where you need to start is you need to treat this, treat this, treat this. You need to open these cavities. Then you begin to treat this arm, this leg, and head. So there's a certain order you go through. And we're going to show you that when we do the exercises. Okay. Now you can read these on your own. Indications for this obviously are going to be, I treat a lot of professional athletes, recreational athletes, car accidents, post-surgical, any internal medicine would benefit from this. And this gives you a whole bunch of different things that are going to respond to it. You can read on your own. These are more indications, contraindications. If you see someone like this, they have hot, scaly, red skin, do not touch it. But I had a guy who came into my office who had that on both legs. He had lymphedema. He came in on shorts. He was off work. I didn't touch his legs, but the exercise I'm going to show you, I had him exercising and I worked everything up in here. Why? Because if I can get his chest moving, his diaphragm's open, he's going to get, everything's going to start to flow upwards, which it did. It took 2 weeks, but we got him. Okay. He's back to work. So I'm just giving you these as caution. If somebody, you can see the difference in the leg length or leg girth. If someone has any clots, if they've been traveling, let's say long distance flights and that, you don't want to be moving things around. They could have some obstruction there. If someone has, congestive heart failure or any type of issues there, it doesn't mean you can't use this. You wouldn't spend an hour long with them. My dad had congestive heart failure. I could do this, but I may only spend, 10, 15 minutes with him at a time. Again, if you have broken bones or acute ankles, you wouldn't work, you wouldn't exercise those, you wouldn't treat those, makes sense, but you could work above it, right? Allow the body to clean it out, right? Using its normal physiology. If you have any renal failure or acute enuresis, again, when you do lymphatics, remember it all goes back to the heart. That's why if you have hypertension, that's an issue. But if you have any kidney issues, remember it's all going to go to the kidneys. You're going to urinate it out. So just be careful about that. People always ask about cancer. Okay. With cancer, they do a lot of research on this in Europe, especially with folding. And they never really had a fear of metastasis. My wife, she had breast cancer. I worked on her. I work on lots of cancer patients. I do a lot of lymphatic work, and there's Foldy there as well. Um, to give you an example, if somebody had a tumor in their chest, I wouldn't work directly over the chest, but I'd work everywhere else around it because I want their body to take over and to begin, to heal themselves and to work physiologically. There's a whole bunch of contraindications I put in here, but these are mainly if you're going to be touching the body. Okay. Like if you're going to be actually in here working on this directly, if someone had a stenosis in there, hyperthyroidism, history of accidents and strokes. And again, if you're not sure, don't do that. When you do the exercise, allow them to do the movement because they have to do these movements anyways in normal activities of daily living. If someone's pregnant, you wouldn't do any deep work. Dysmenorrhea, you wouldn't do any deep work. Diverticulitis, the same thing. Sometimes when somebody has a lot of allergies, when you do that, it could spread if they're, in a flare up. With older people, this is more if you're going to be touching them, if they're elderly and they bruise easy. My techniques are all gentle anyway. If you're working with someone, they have low blood pressure, always tell them get up slowly. Make sure there's somebody there, especially if they're elderly. And if they have any unexpected pain or weight loss, they should always contact their physician. All right, good. We have the time. So here's what I want to do. I want to make this active for you guys. So stand up, even though I can't see you, stand up, because I want you to go through this yourself. And I want you to feel the difference on yourself. All right, so stand up. And what I want you to do is just march on the spot. And I'll show this here. And I want you to close your eyes. And I just want you to self-evaluate your posture. I want you to be aware if you're weight bearing more on your right foot or your left foot. I want you to tune into your legs. Do they feel the same? Right? Is there more tension in one leg versus another? Does one leg feel more full or empty? Do you feel any asymmetries? Like is one leg extended, one leg bent? Okay. Your pelvis, is your pelvis rotated at all? Or is it shifted or side bent? Now tune into your belly and your chest and take a deep breath in. Does your chest expand? Does your belly expand? Or does it feel very tight and rigid? What's happening with your shoulders? Does one shoulder feel higher than the other? Does one arm feel longer? Is one arm closer to you than the other? Or how about is one arm bent or straightened? Or are they rotated in or out? Then you can look at your head. Does your head feel like it's forwards or backwards? Does it feel like it's rotated one way or shifted or side bent? Okay. And then tune into your thoracic and lumbar, any asymmetries or tension there. So just give yourself just a quick assessment. The next thing I want you to do is we can do some movements. So you can very gently bend your head forwards and backwards. Just feel what that feels like. Turn your head to the right and to the left. What does that feel like? Maybe side bend it. Okay. You can, lift your arm up, abduction. You can flex it, do one side then the other, and go to the first sign of resistance. Okay. You can also do rotations, external or your arm behind your back. You can do that. You can look at your whole spine so you can bend down to the floor, maybe bend backwards. See what that feels like for you. You could bend sideways, see what that feels like for you. Maybe rotate. Okay, so just assess yourself and see what you like. Now you can hold on to something and maybe lift your knee to your chest, see what your hip is like. Okay, you can, as you're standing, bend your knee and straighten it, see what that feels like. Stand on one foot and just kind of move your ankle into plantar and dorsiflexion, and feel what that feels like on both sides. So just kind of feel, for your body. And these are all, different things you can do. All right. So now what we're going to do is I'm going to take you through the last remaining time. I want to take you through some exercises. So this is going to organize it. Remember, everything goes back to the heart. So we're going to do thoracic cavity. There's 3 exercises here. Okay. And remember, everything flows to the heart. So I've got videos for this, but I want you to sit and I'm going to show the video. And I want you to do at least 5 of these. If you do a little bit more, that's fine. And you want to do them in the order. Okay. This next exercise is kind of a spinal roll down and it's coming back up. I'm going to turn this a little bit louder. Good. And she's going to tuck her chin in like this. And I want you to see what happens. See the pressure we're getting in on the sternum and up here. And then we also get the abdomen involved. And then you're going to come back up like this, nice and rhythmic. So it's getting a lot of the deep drainage in the chest, the sternum. It's also getting the clavicles. It's also getting the deep neck flexors. I like this exercise because it also gets a lot of the deep drainage in the abdomen. So it's a nice pumping exercise. So you're going to come all the way down like this. Good. Come all the way down. Make everything a bit tight. 1, 2, 3, and then come back up. Perfect, like that. So you're going to do that very rhythmic. This neck. Okay. And you're going to slump forwards. 1, 2, 3, 4, 5. And I like to actually stick the chest out, coming back up, how I do it. So you're going to flex forwards. 1, 2, 3. You want to do it rhythmically. You don't want to do it too fast. So we want to feel the tension in the sternum as you do this. Okay, that's the first thing we want to do. Now, the next thing we want to do is we want to do anterior arm lifts. Okay, this next exercise is an anterior arm lift with respiration. So I'm going to have your thumb straight up like that. You're going to breathe in and lift your arms over your head and stretch. 1, 2, 3, and relax. 2, 3. Watch what happens to her chest as she lifts. It's a rib raise. So it's opening up the ribs and stretching. This next. Okay, so you can breathe in and out as you're doing that. So as you're lifting it, lift it up. 1, 2, 3, and down. And this opens up the chest. So we did the flexion extension in this area, and now we're doing the rib raise. Okay, so you want to do at least 5 of those. Okay, so the next thing we want to do is we want to do this shoulder roll. Okay, and this is where a lot of lymph nodes are in this clavicular area. We want to get all this area moving. Exercise is sort of a posterior shoulder roll. I like it because it gets this whole area moving. It's all this thoracic inlet where the clavicles are, the ribs 1 and 2. So what you're going to do is you're going to lift your shoulders up, squeeze them together at the back. Good, nice big roll. Come up. 1, 2, 3, and then don't forget to pause. Good, and back up. There, and then relax. Good, and then come back up. Relax. Good. Again. Okay. So you want to do that. So we did the first one, the flexion, extension. We did the arm lifts, and we did the shoulder rolls. Now we want to do, as we open that up, we want to go into zone 1, right? We want to go into zone 1. And the first thing we're going to do is we're going to do a lower than an upper cervical flexion and then a facial pump. We're going to do it in that order. Remember, we work proximal to distal, distal, proximal. So I'm going to start lower cervical, then upper cervical, then the face, and then I'm going to work my way back, but I'm going to work it all the way back to the heart. So you'll see. Okay. So lower cervical pump. Let's say your patient has swelling in the anterior cervical region, or they may have a lot of swelling in this area. You want to create some movement. So you're going to tuck your chin in, and I want you to contract these muscles, create a pump. 1, 2, 3, and then just let it go. Chin to your chest. Squeeze the front of your neck. Remember, we have a lot of the deep cervical nodes there. So again, come down, squeeze. 1, 2, 3, and relax. 2 more. Then we come in. 1, 2, 3. So we have lymph nodes all through in here where their sternocleidomastoid is. So you want to come down 1, 2, 3. And I like to do a little extension with that as well. Kind of 1, 2, 3, and relax. You want to do at least 5. Now we want to do is the upper cervical. Okay, we want to do the upper cervical. We want to go a little bit higher in the neck. If your patient has swelling in more of the upper cervical spine, we can do a little bit of upper cervical flexion. Just tuck your chin in and bring it down to here. Good, perfect. 1, 2, 3, and then relax. 2, 3. Bring it down again. Excellent. 1, 2, 3, and then relax. 2, 3. Down again. 1, 2, 3, and relax. And then again. 1, 2, 3, and relax. And then once more. Perfect. Okay, your patient. Okay. Now we want to go into the face. And it's interesting, the brain will drain out to the cranial nerves of the face. So what you want to do is you want to scrunch your face and then relax it. Let's say your patient has swelling anywhere in the face. An active lymphatic pumping exercise we can do is kind of like a face squeeze. I want you to scrunch your face up as much as you can. 1, 2, 3, and then relax. Let it go. Scrunch it up. 1, 2, 3, and relax. Scrunch it up again. 1, 2, 3, and let it go. 2 more times. Scrunch it up. 1, 2, 3, let it go, and one last time. Let's say you're right now. We've worked our way lower cervical, upper cervical to the face. Now you have to do the face again. So right now, I want you to squeeze all the muscles in your face. Just do it 5 times. Kind of hold it. 1, 2, 3. Okay, 1, 2, 3. Let's do that 5 times. So remember, we work proximal to distal. Now we're going to work distal, proximal. Now you're going to do the upper cervical. So now you're going to bring the chin to the Adam's apple and then extend a little bit. Chin to the Adam's apple and extend a bit. Try to do that 5 times. Okay. And then I want you to do lower cervical. 1, 2, 3, and relax. 1, 2, 3. So we worked our way from the heart all the way up to the face. And now we're working backwards. I'm working with a patient right now. He had a cancer in the tongue area, and they did a lot of lymph node removals and that. He's doing all these exercises right now. Okay. So what do we do after that? Do the shoulder roll again. Okay. Do the shoulder roll. Okay. And then what do we do next? Do the anterior. Breathe in, lift the arms up. Okay. Lifting it up. And if somebody's old, I usually say, do 3. If you're young, most of you be younger, you can do 5 of them. And then what's the last thing you want to do here? You want to do, okay, working on slumping and then back up. Okay. So we've opened up the thoracic cavity and we ventured into zone 1 and we brought it back out. So the next thing we want to do is we want to go to zone 2. We want to go to the axilla. Okay. So we want to get this area moving. And all that, remember, everything in zone 2, which is your breast, your upper abdomen, your arms, thoracic, is all going to go into the axillas, subclavian vein, superior vena cava to the heart. We've already opened up the thoracic, but we're going to take it back there, aren't we? So the first thing we're going to do, you might want to get, if you have a little towel, you can. If not, you can just squeeze them. So we're going to do shoulder adduction because we need to get those axilla nodes. Think of nodes as like sponges filled with fluid. We want to get some compression there. This next active lymphatic pumping exercise is active shoulder isometric adduction. And what we want to do, remember the axilla nodes are in here. So I'm going to place this towel up in here as high as I can, and she's going to come in like that. And all you're going to do here is I want you to focus on here. I want you to squeeze into the towel. 1, 2, 3, and then let it go. 1, 2, 3, and let it go. 1, 2, 3, and let it go. This next step. Okay. And then the next thing you're going to do is you're going to do a lateral arm raise. Okay. So let's say your patient has some swelling anywhere in this arm, or also a lot of swelling in this area. Remember, this is a key area. We get a lot of drainage in here through the jugular ducts, the subclavian ducts, bronchiocephalic. So it's a very important area. So what you're going to do, we're going to do this on both sides. Arms will be, down low. And I'm going to do it for you first. Just kind of lift up like this over your head and kind of give it a little bit of a stretch. 1, 2, 3, and all the way down. Good. Let's do 4 more of those. Breathe in, lift up. A little bit quicker up to the top. 1, 2, 3, and relax. You want to take about a 3 count to get up there. So 1, 2, 3, perfect. Stretch and then down. So let's say.
All right, now we want to go to the elbow. We want to do an elbow pump.
Hey, if your patient has swelling in the elbows or biceps or even the lower arm here, all you're going to do here is you're just going to flex the elbow, squeeze in here, make it tight, 1, 2, 3, and then let it relax as you come back down. Then come back up, squeeze it in here, 1, 2, 3, and then all the way down, let it relax for a second, come back up, squeeze the bicep, 1, 2, 3, and then let it go, up, and then back up, 1, 2, 3, and let.
Okay, now we go to the wrist pump.
Your patient has swelling in the wrist. What you can do is their elbows at 90 degrees. I'm going to get you to bend your wrist up like this, make a contraction, and then just let it go. Come back up, make a contraction, and let it go. Good. Back up. Contraction, 1, 2, 3, and then let it go. Back up, 1, 2, 3, let it go.
Okay, and then the hand.
If the patient has any swelling in their hand or fingers, what we can do is the arm can get like this. This hand can support it. So spread your fingers apart. What you're going to do is squeeze it all together, kind of 1, 2, 3, and then let it stretch out. Squeeze 1, 2, 3, and let it stretch out. Again, squeeze 1, 2, 3. Relax. Another one. 1.
Okay, now once you've done that, we've worked our way from the axilla nodes all the way down the arm. Now you want to take it home. You'll do the hands. So instead of just doing 5, you'll do 5 more. So a total of 10. Do those first. Okay. And then you're going to work your way back. You're going to do the wrist pumps. So if somebody had swelling in their hand, you wouldn't start in their hand. You'd start in their chest, work your way down the arms, right, to the hand and then back again. So you do the wrist pump next. Okay. And then you do the elbow pumps. Okay. 3 to 5. And then lateral arm raise. Again, 3 to 5. Okay. And then the shoulder abduction. And you can try, go through this in more time after we're all done if you want to go through it all again. Now, where do we go next? Where does it go? Well, you want to do your shoulder rolls. We're trying to bring it home, right? Do your shoulder rolls. And then anterior arm lifts, right? Get the pumping going. And then you'd finish with slumping forwards and coming up, slumping forwards, coming up. All right. One last one we're going to do is zone 3, the inguinal. Okay. So the inguinal, we've already opened up this thoracic cavity. We need to open up the abdominal cavity, and then we need to go down the leg. Okay. So the first thing we need to do is this lower body twist.
Okay, this next exercise is just a lower trunk rotation.
So you can lie down for this.
Knees in one direction. So she's getting a nice little stretch by itself here. 1, 2, 3. And then come back. And then she goes the other way. So this gets a lot of the.
And then you want to incorporate the arms.
1, 2, 3. And then come back down. 2, 3. Roll this way. Lift up over your head. Breathe in. 1, 2, 3. And then relax.
So when you do this, when you're rolling the knees side to side because of the interconnections of fascia, you're lining up tension to that respiratory diaphragm. And remember, everything has to flow through there. And when you lift the arms up, you're opening up, you're breathing in, and you're raising the ribs as the diaphragm is going down. And we're also getting that side to side motion. I use this one a lot.
One more each side. Good. 1, 2, 3. So now we're adding a lot of the rib raising with this, stretching up into sternocleidomastoid and also into.
Okay. Now we want to do a spinal roll up because we want to get that deep drainage, remember, inside the abdomen.
This next exercise is a supine roll up. You're going to place your hands on your thigh. You're going to tuck your chin. You're going to reach for your knees. 1, 2, 3. And relax. 2, 3. Good. Let's try that again. See how she's contracting her abdominal region also in here. Come back down. So this is very good for deep drainage. 1, 2, 3. And relax. 2, 3. Good. 1, 2, 3. And relax. 2, 3.
Okay, now there's lymph nodes in the groin, so we have to do the hip flexor pump.
Next one is hip flexion. So we're going to start in this position here. And what she's going to do is bring the knee to the chest. So 1, 2, 3, and then back down 2, 3. So we want a contraction right in here. So think of lymph nodes inside the groin. Think of them as sponges filled with fluid. When you bring the knee to the chest, you're squeezing the sponge and then you take it out. If you just had swelling down that right side, you just do the right hip flexion. If you're more systemic, I usually do the right knee and then the left knee. Right knee and then the left knee. This is good for the inguinal nodes. And then relax, 2, 3. Come back up. Good. 1, 2, 3. And relax, 2, 3. And then back up. 1, 2, 3. And relax. 2 more. Okay. Then the next one, you have a lymph node behind the knee. So we're going to do a knee flexion pump. So this next exercise is a heel slide. It's going to bend the knee. So come together, 1, 2, 3, and then relax, 2, 3. So remember, we have a lymph node behind the knee. So this is pumping that lymph node, 1, 2, 3, and relax, 2, 3. It also helps any swelling inside the knee itself. 1, 2, 3, and relax. We'll do 2. Okay. And then finally, we do the pedal pumps. They're going to be on their back and they're going to pump their foot and ankle. This next exercise is a pedal pump. You're just going to pull the foot up towards you, 1, 2, 3, and then relax, 2, 3, and then come up. So you can see we're using, as she pointed there, we're using the calf. As she's coming up, we're using this muscle. So it's really helping the lower leg as well as the ankle and the foot. Okay. Now, when you start to take it back, take it home. There we go. You'd make sure you do more of the pedal pumps. Now, if it's bilateral, if you have a lot of swelling, I like to do one foot and then the other foot. And then come back. What are you going to do next? You're going to do the knee flexion. Okay. Do one side, then the other. So we worked our way from the heart all the way down to the foot, and now the foot back to the heart. And then we do the hip flexion pump. Okay. And then we'd go into the abdomen. We do the spinal roll up. We do the lower body twist, okay, with the arm lift. And then what do? We need to go back to the shoulder roll. We do the anterior arm lift. Okay, and then the spinal roll down. Okay. And then what I would suggest, we don't have time now, but reevaluate yourself. Go through these, I would go through all these exercises again, get them in your memory, reevaluate your posture, reevaluate your range of motion, and see for yourself, did it make a difference in your body? Okay. Now, the final thing is systemic. I'm going to go through this real quick. So we'd start in the heart, right? The flexion, extension. We do the arm raise. We do the shoulder rolls, right? And then, right, we work our way back, shoulder rolls, arm, and that just to make sure it's open. And then we go after zone 1, remember? Cervical flexion, lower cervical, upper cervical flexion, okay? And then remember the face. And then you do the face again. You do upper cervical, lower cervical. And then you'd take it home, wouldn't you? Shoulder rolls, arm lifts. And then you'd slump. We'd go to zone 2. Remember, we had a towel there, squeezing it. We do the arm raise laterally. We do the elbow pump, wrist pump. Then we did the hand flexion extension. And then we start the hand, work our way back. Wrist, elbow, shoulder, axilla. And then where do we go next? We take it home. Shoulder rolls, arm lifts, flexion extension. And then we go down. We do these arm lifts with the legs going left and right. We do the quarter sit-ups. We do hip flexion, knee flexion, pedal pump. And then coming back home, pedal pump, knee, hip, sit-up, and then the spinal twist with the arm lift. And then where do we finish? Shoulder roll, right? Arm lift, and all of that, okay? Now, if we go here just to the vibe board really quickly, we always start here, and then we go up to zone 1, and then we go down to zone 2, then we go down to zone 3. So we always start in the center and work our way out. So that's the zone, 1, 2, and 3. So our mission at D'Ambrogio Institute is basically to help you guys as healthcare practitioners make better clinical decisions. And this is done by knowing where to treat, using that chart, which you guys will have, whether you have to do it systemically or specifically. Watch the video, right? You got a video there you can watch, use a QR code, and you have to know what to treat. And you do that through the systemic and the specific evaluation. And then you need to know how to treat. You need to know how to do the techniques. Now you've just learned, some exercises. If you need to contact me, this is in the study guide. That's my clinic. I'm in Sarasota, Florida. Okay. And that's it. All right. Any questions?
I did see some chats come in, Carrie. And
Let's
totally
see.
forgot what you told me about the remove spotlight or add spotlight.
You're
So
fine. You just leave me like this. All
we'll
right.
just go with this, all right?
All right. See
Um,
you.
let's see.
Okay.
Janice was asking if a client has heart issues, do you
Yep.
need to be more careful about the lymphatic drainage in the clavicle area?
No, you want to do lymphatic drainage there. Definitely. If someone everything has to flow back to the heart. And so you can do all these things. You have to make sure how long are you going to do it for. My father had congestive heart failure. I worked with him, but I would only do like 10 minutes, 15 minutes, not longer sessions because his body has to tolerate that. And you know that any of the techniques you do, you always have to compromise. How old is someone? But more importantly, what's their vitality like? Everybody's not an elite athlete. Athletes, you can, do 2 hour sessions. When you are working with someone who's compromised, you have to modify, what you're doing. So yeah, we take that into consideration.
Okay, and Janice is also asking about zone 2 with
Okay.
clients with lung and respiratory issues.
So if we go to zone 2, which is right here. So zone 2 is basically between here and here, and it goes down either way, and everything flows into this area. So zone 2, right, has nothing to do with lungs. Zone 2 is all about the arms, right? Zone 2 is about the thoracic. It's about your chest, meaning your breast and your chest, your ribs and your upper abdomen. So nothing to do with the lungs. Now, the lungs are all in what? The thoracic cavity. Okay, in the thoracic cavity. Okay. So you got to remember that zone 1, 2, and 3 have to do more with like superficial type drainage. Okay.
All right. Avril is asking, would the knee lift be helpful for Baker's cyst?
The knee lift, you mean the knee flexion? Knee flexion? So if somebody had a Baker's cyst, that's a good question. Let me go here. So let's say somebody had a problem with their right knee. So a Baker's cyst is back here. So the question you should ask is how's that going to drain? Well, that is going to drain up here into this inguinal area, and then the right lumbar trunk, and it's going to go through the diaphragm into the thoracic all the way here to there. So when you do someone who has a Baker cyst, you gotta do the flexion extension in the chest. You'd have to do the rib raise, the clavicle, and then you'd have to do that spinal twist with the arm raise, the sit-ups. You'd have to do hip flexion, then knee flexion, and then you'd work your way all the way back. So yes, it would help. But you wouldn't just go to the knee. You'd have to work your way proximal, distal, distal, proximal.
Okay, very good. And Dr. Dottie, would you work people with gross lymphedema of the extremities the same way? They
Yeah,
may not be able to lift their legs.
yeah, you always have to modify. That's a good question. Is that everything I teach, you can use it for lymphedema. I had a lot of lymphedema therapists attend my classes, but when you're dealing with lymphedema, it's a pathology. You need to make sure you understand bandaging, and also with, let me just show you one thing here, just so you're clear. Now, you could have somebody come in with, let's say, swelling in the elbow or swelling in the knee. So remember, the way that our course is set up is for musculoskeletal problems. So then you'd work your way to the elbow and back, you'd work your way to the knee and back. When you have lymphedema, let's say you have lymphedema here, it's usually swelling of this whole area, not just the elbow. You could have swelling here of this whole leg, not just the knee. So it's a very different approach. And so when you have this, you would have to come all the way down here, but you would work this little piece, and then you'd have to take it back, and then you'd come down and work this little piece, come back and forth, and then this little piece, this little piece. So it's very time consuming. And then you'd probably have to bandage them and use compression things as well. Same thing here. When you come down here, you'd remove this little bit, then you'd have to go here. So it's very a long process. So lymphedema is very different, but you can still incorporate the same exercises, but the approach will be very different. It's more time consuming. These people that work with lymphedema are very, very highly specialized people.
Okay, and Amy is asking, can this help with chronic inflammation and elevated CRP levels? How would you work with someone with chronic neck, back, and hip pain?
So again, when somebody has all those problems, I would do a total body screening examination first. I watch that video because that's going to tell me how I'm going to work the approach. So normally in my clinic, let me do it this way. I'll just explain it this way. So when I use a pyramid, okay? And this is how I think. So when somebody comes into my office, I want to find out, level one is you're in constant pain. Could be in all those places they mentioned. So when somebody's like that, I want to make sure that I'm careful with them. Do they need a cane? Do they need crutches, a walker? You know, we have, and I'm going to mainly do a lot of manual therapy. Maybe I do exercise. Maybe I will do lymphatic, but everything is to get them out of pain. And people always say, well, how long is treatment going to take? I don't say I'm going to wait to, I want to get all better, right? This is all better. I'm going to say my focus is to get you to level two. And what level two is like a roller coaster, meaning that the pain's not there all the time. It comes and goes, right? Certain things are going to cause it. And this is good when we can get them into this level because now we can start to introduce more things like what I'm showing you today, some active lymphatic pumping exercise. Level one, I'm going to be more with kit gloves. I'm going to do more things with them because they're in a lot of pain. If you give them a lot of movement too early, you're going to flare them up. Okay. Now, my whole goal with level two is not to get them all the way back to normal, is to get them to level three. Level three is you have no pain, but you're maybe deconditioned. So my focus now is a lot of exercise, mobility, flexibility, strength, things like that. So there's a pathway. And then finally, at the end, people always go, what do I do next? I go maintenance. I never discharge a patient. I always bring them in and I work on them. You know, could be once a month or every 2 months. I get worked on. Some of you may know Jack Ryan. He used to work for me here. He treats me once a month. I treat him. So I'm a big believer in doing it. But that's how I see things in the pyramid. Is I don't treat everybody the same. I find out where you are in that pyramid. And it's interesting. I after I explain the pyramid, I ask the patient, well, where are you? Oh, I'm at one, or I'm at two, or I need this. Okay. And you're gonna know when we're at the next level, because then you're gonna know when we can discharge you or we get you into maintenance.
All right, and I don't see any other chats have come in, so there's a minute or two while I ask Kerry, what do you have coming up? Anything you'd like to let the audience know?
Yeah, I've been since COVID, I've been actively busy redoing everything, and my website's up, the new website, drkerry.com. Uh, but I'm going to be, it just needs about 20% more till it's done, but I do have it up. My focus now is I've put everything into two tracks. One is the energy manual therapy program. One is the orthopedic manual therapy program. And so what I've done is on my website, hopefully it'll be done in the next few months, is you can take a free orthopedic or energetic manual therapy introductory class, usually about an hour, hour and a half. You know, people are curious, so that's where you're going to get it. If you feel you want more, the next level is a orthopedic or energy manual therapy foundation class. That's usually a 1-day class, and all these will be online. And so when you take that class, then you're going to have an idea, do I want to go further? And if you want, these are all pre-practitioner training. And if you want to go further, we have practitioner training for the energetic and the orthopedic. And for the orthopedic, it'll be systemic training and then specific. And then in our energetic, we have level 1, 2, and 3. In December is going to be our level 1 class. And if you're interested in taking that, there are no prerequisites. We give you the introduction and the foundation class just to see if you're interested, but it starts level 1. And this is going to be the first 2 weekends in December. So you can contact me at kerryjdam@gmail.com as well. I think there's some contacts in there. But that's I'm hopefully going to get all this up this year. And our goal is to offer a lot of these online, but also offer a community and offer things like this, that online Zoom where you can ask your questions. So that, you know, I think this is really important what you're doing.
Well, thank you. I don't see any other chats that come in. Thank you. Excellent time spent with you. Thank you. And what I would like to announce is the upcoming Edu Talks. And Kerry, I should thank you, but I'm going to save that till after I do the upcoming.
That's fine. Yeah.
Okay. December 2nd. And this is through the end of the year. And thank you for closing out our November EduTalk series. December 2nd, we have Dr. Renee Lutz presenting on craniosacral therapy and autism. What is the link? Then December 9th, we have Anne Bromham, manual lymphatic drainage, the practice. So that would be a good follow-up. And December 16th, the final EduTalk of 2025 is with Dr. Susan Salvo on C-section recovery, postpartum depression, and infant massage. And Dr. Renee's EduTalk for craniosacral therapy and autism, the RSVP opens tomorrow. For those of you not familiar with EduTalks, every time we finish an EduTalk, the following day you'll receive a follow-up email. It will include the recording. It will include the presenter handout. It will include the presenter contact information. Now with Kerry is a past presenter of EduTalk. So in the follow-up email tomorrow, you'll also get the titles of his EduTalks, and those are hyperlinked to his recordings. If any of you would like the handouts, just feel free to email me for those. Thank you very much, Kerry. You shared wonderful information with us over the years, and I can't thank you enough. We'll look forward to seeing you again in the first half of 2026. So everybody mark, I'll put that in the follow-up email so you know when Kerry's speaking in 2026.
All right.
Thank you so much, everyone. And be safe.
Thank you for having me, and thank you, Biotome, and happy Thanksgiving, everybody.
Yes, and be safe. Thank you, everyone. Enjoy and take care.
Bye-bye. Thanks.
Bye.